This is a part of our continuing series on the dissemination of the report of the Mental Health Task Force, which you will recall was put in place by a government pursuant to a cabinet directive of November last year, which was itself the result of a directive from the president on Madaraka Day 2019 in Narok. I think there is absolutely no doubt that the importance and significance of mental health and related matters in our country has continued to make itself manifest. There are more and more people thinking and talking about mental health issues, and that can only be a good thing from where we sit. Some of the participants are here today because they observed the presentation of the task force report to government a few weeks ago. And in accordance with the general government policy, requirements of the Constitution, and in general good practice, we as members of the task force have decided that it's a good thing to form this kind of engagement with the true stakeholders of this task force report, which is the Kenyan people themselves. In previous webinars, we have discussed a whole lot of things. We have discussed, for example, the whole background to why it is that we were formed. We have discussed the whole concept of mental health and the whole idea of well-being. 2 weeks ago, we had a very interesting discussion and deliberations on the burden of disease in our country. And I think at that time it was clear that our country suffers a great deal of burden with very little by way of resource allocation to deal with a very serious condition in our country. Last week, we were taken through by two experts in a discussion on mental health and special populations. And it was clear from that there's a great deal of exclusion from center stage and from center care of people like boy child, refugees, immigrants, women, and other groups that really have a great deal of need, but who are very poor access to care in our country. Today, we have the greatest possible pleasure in welcoming actually three members of the task force. Halima Mwenesi is right now in the United States, where COVID found her. Halima is an expert and was a key player in the preparation, in fact, of this particular chapter. She has sent a presentation which will be done on her behalf by members of the Secretariat. And we'd like to thank Halima very much. I think on the screen you can see Dr. Bernard Olayo, a medical doctor and a public health expert who currently works for the World Bank. There are people who thought that this task force consisted only of psychiatrists. In fact, those are two experts who are non-psychiatrists and who really were very highly qualified to work on this particular chapter. Those who were with us last week will remember Mr. Raymond Ochieng, Secretary for Youth, IT, and in the Republic of Kenya. He will hopefully be joining us in a few minutes. He's an extremely busy man, and he will also be doing his presentation this afternoon, covering the special issues that relate to the youth. Dr. Njuguna promised last week that he will be doing as a presentation on where it is that we move to from presenting this report to government. And he will also have a few minutes this afternoon to do today what he was not able to do last week. It's now exactly 5 minutes after 3 o'clock, and I have the great pleasure of asking Bernard from the World Bank Group and a prominent member of the task force to please kindly do your presentation. Bernard?
Thank you very much, Dr. Njenga, and welcome all the participants who've joined today. I think the way I thought we could do this is by beginning to talk about the so what. We've gone around the country, we've talked to all the experts, and they've all told us what's wrong with us as a society. But I think the most important part is for the people themselves to understand so what. And the so what is, what can you do about it? So the talk of today is to identify some of those factors that affect people's mental health. And I want to believe that there are factors that you can do something about at the family level, at the community level, within your society, in whichever way you are organized, to modify them. And I think this is important because when we go around, or when we went around the country, people showed us the magnitude of the problem. And they probably didn't understand why is this problem so high. So I will talk very briefly about some of these factors that have been demonstrated to contribute in a measurable way to mental health problems in our society. I will also try and link them to the current situation that we are living in, because we are right now in the middle of a pandemic, one that has not been seen in a very long time of this proportion. Maybe from 1918, we haven't seen a pandemic of this magnitude in a very long time. So that also contributes to this. So what are these factors that we live with that have been shown to contribute to our mental illness? Some of them, and they're quite common in Kenya, is when people don't have enough income. So the low income earners, the fact that you have very little or no income at all is something that will put you at a risk of some of these problems. And then therefore, when we think of our country today, even within this COVID pandemic, even those who had some income before have lost it, because many employers have closed shop, many hotels, many workplaces have really gone down. When you go around town, you see a lot of businesses closing down. And that means that the people who are working in those places are going to lose income. That in itself is likely to affect them. The second factor is, living without a partner, living alone. So, and this is something that we again see more often when people are moving into cities and you are all alone and you come home alone, and it can even be worse at a time like this, when if you are unlucky to be put into some kind of a quarantine at home because of COVID, and you are all by yourself. Now, that in itself puts you at risk. And I like that fact, because there is something you can do about that. You can get out, you can talk to someone, or if you have a neighbor that lives alone, you can knock on their door and say hello to them or invite them to a social event so that you begin to help them with any of the needs that they may have by just talking to them. The third one is lack of social support. And I think this is an area that has been studied very extensively. And it shows that people who have, social support around them, people who belong to an organized group, you belong to a church, you belong to a chama, you belong to, and increasingly now, I think our social structure is moving into, social media. So you belong to some group somewhere that you can congregate with very frequently. That helps you. So lack of such kind of support, whether it's family, your church, organization, I think that help that make us be at a risk of developing some of these mental health conditions. There's one factor that I think has been mentioned over and over again, and I think I will highlight it to Dr. Njenga, who's an expert in this area, to talk about it, and maybe we can discuss it later. Why being a female or a woman puts you at a higher risk of some of these things. I think that's something that I will not go into right now, but would also want Dr. Njenga to come and discuss a bit. Then there are other related factors like low socioeconomic status and low levels of education, which are factors that I think have been known to contribute to some of these mental health problems that we've talked about in the report extensively. Now, the question is, what can you do about it? So we all live in a society. We live with our neighbors. We live with our workmates. We live with our families, and we know people. So if you know someone that, for example, lives alone and is your workmate or is your neighbor, then it's important, especially at this time when we are going through a lot of problems in the society, that you should reach out and try and talk to them and try and interact with them. You may just find them at the brink of something that would be a disaster. Um, then we also know that there are some people that are extremely going through a hard time, financial time. They've lost their jobs. You may not be able to do much about it, but it's good to be aware that that job loss is not just going to lead them into some kind of, joblessness, but it also likely to contribute to them developing a mental health condition as a result. So it's really knowing that this particular person or this particular group or this particular setting is likely to lead to bad outcomes or put those people at a higher risk of mental health conditions, and then thinking about what you can do about them. So that's what we can do at an individual level. Now, from a task force perspective, we think there are certain things that the government can also do to help to change or to modify some of these factors. So, for example, if you look at our informal settlements, then a lot of the factors that I've talked about tend to congregate in the same place for the same population. People have no jobs, they have sometimes no education, sometimes low socioeconomic status, and really no place to interact. And therefore, if we can find ways of modifying these environments to create safe spaces, particularly for young people, to interact with each other, to talk to each other, to play with each other, I think that could contribute significantly to enhancing their mental well-being. And also there are certain changes that we can make at the policy level for a time like this, and I think the government is doing a bit of that right now, where they are trying to cushion some of the families that are suffering job losses by instituting some kind of cash transfer programs to those families to help them deal with some of these conditions. These are some of just the introductions, and I think today what we wanted to do was more of a listening to the participants, and your questions will help us to really go deeper into what we found and how we can all work together as a community to try and improve the well-being of everyone. Over to the moderator. Thank you.
Thank you so much, Doc. You've raised a very specific question to me, not as chair, but as just a practicing psychiatrist. And this is to do with the whole conversation about the females and mental illness, and in particular depression. I think that's where we are going. I mean, there are so many possibilities. I don't think any expert can claim to know them all, and they vary from different circumstances. There's little doubt that biology has a role to play in this. I think the differences can be traced way back to adolescence and even earlier, some people say. The fact of the whole female reproductive cycle, the fact of pregnancy, delivery, and so on. All those biological things have a role to play. But I think there is also the social thing, the fact of the way we socialize our society. Two things come into play. The first one is that, in a manner of speaking, women are allowed, in fact, encouraged to express their feelings, and men are encouraged to hide them. And therefore, it may appear that there are more women who are getting on to mental health services. But that's only because the men are either in jail, not having expressed themselves as the ladies do. And if they are not in jail, they may have killed each other, or they may have died in road accidents, or they might be finding peace, one would hope, in rehabilitation facilities. So really, there's a lot that can be said about that whole subject. As you said, Bernard, today we are hoping that we'll be able to provoke conversation with our interlocutors who are participating in this. Yeah, more than we have done before. So I will now ask, I think, is it Priscilla that will do the presentation that was intended to be from and by Halima Mwenesi, who is, I believe, at this moment attending a meeting in her native, well, not native, where she is in Chicago. So Priscilla, do you want to tell us what the lady, Dr. Mwenesi from Chicago has sent to us? And maybe you can tell us a little bit about the background as to why we cannot hear her voice this afternoon, and why you are the one who's doing the presentation. Over to you, Priscilla.
Good afternoon, everybody. So as Maureen sets up the screen, unfortunately, as we said, Dr. Halima will not be able to join us physically, but we have her presentation, which we will do a quick run through, and then also just give time for the questions, as they come up. So the screen is there. So basically, she's also going to just touch on her presentation. Just touches on a bit on what the Kenyans found and what they told us as a task force, and also how we can go about implementing it. And I see there's even a question that will also be answered in her presentation. So basically, Kenyans were asked what they think is the issue, what are the risk factors, what do they understand by social determinants of health, and also what they propose to be the solutions to this. So what are social determinants of health? These are circumstances in which people are born in, where you find yourself, how you grow, circumstances that are surrounding your life, how you work, and the age that you're in, and the systems that are in place to assist those affected by ill health. And these circumstances are further shaped by your social environment, economic environment, political factors, which influence access to resources like security, education, and also influence healthcare. But kindly note, these are not fixed rules about who will develop mental disorders. We don't have a fixed rule. As we say, anybody can get a mental disorder at a different or specific time in their life. It's not a must that these determinants are the ones that are cast in stone. So you're all at risk, although certain situations usually increase a person's level of vulnerability. Please take the screen up. So some of the risk factors that were identified, poverty and the consequences, as Dr. Bernard Olayo has graciously taken us through. Another thing was poor social cohesion. This resulted in dysfunctional communities, like you have broken families, the people that are not able to integrate as a family together and have discussions. We're having early life abuse and traumas, substance use and alcohol misuse. We also have poor education, traumatizing cultural practices. Like currently we have female genital mutilation as an example. Currently it's illegal in the country, but it's still being practiced, and hence our ladies, our girls who go through it have some form of they develop some form of mental disorders, if you follow them through, not all, but some. Also situational circumstances like what you find yourself in. Currently we have IDPs, so the displacements due to different conflicts, due to different political environments, due to the elections that came up, or just different displacements if you have family conflict and you can't stay at one place. Ethnic clashes, as I said, insecurity due to terror. I mean, like currently we've been having in the past 5 or 10 years or so, we've had the terror attacks, so that insecurity also, and the anxiety that comes with it. Crime and natural disasters, some climate change resulting in droughts or floods or diseases. So these circumstances that you find yourself in can also be a risk factor to having a mental disorder. Some choices you make in life are not really the best, yeah? So you find yourself in a fix, like if you're in gambling, you cannot be able to pay up your debt in time, and that actually eats up into your mental health. Also, maybe you're in substance use disorder and you have issues with your family, with yourself as a person in that state, and also with your family and interacting with one another. So those choices actually will affect your mental health and might lead to a mental disorder. Another thing that we noted from Kenyans was poor governance and toxic politics. This comes in like during the election years and the election period. You find there's a lot of anxiety, and we have a lot of issues coming up, and people don't not really know, especially the fact that we've had post-election violence before. You're not so sure if it's going to happen again. Should you move from one place to another? You have large number of that's during the political area. Also in our environment, we have a large number of people who are educated but actually jobless, and this is due to the poor governance and the poor policies we have in place, and that actually will come and will be able to affect your mental health in different times. But as you said before, these are not cast on stone. They're just risk factors. It doesn't mean that because of those reasons, that's a reason why someone will get a mental disorder. It's just one of the risk factors that were noted. And so what were the solutions that were put in place? The solutions that were put in place would be, one, the government should promote mental health and wellness in the families, communities, and in workplaces, so it can bring about the social cohesion between one person and the other, in the families to work together, in workplaces just to be able to bring out this culture of having therapy at work and be able to just get us to work better. Also, all existing and new laws and policies should be assessed for their impact on mental health, well-being, and amended appropriately so that it can promote mental health in all areas of life. We also, the government was advised, there's some of the things that were said was it should have improvement of governance at national and county levels to promote safety and security for all. And this would be good to help us in the security angle, the anxiety that comes with our safety. So these are some of the things that came up from the report, and from the people that were able to talk to across the country. And in closing, she also noted that as we go through the pandemic currently, it's a situation you find yourself in. It is noted that it will actually be one of the determinants of your mental health, and it will be good to just take care of yourself. Thank you so much. That's what Dr. Halima had to say. We will post the audio in the social media platforms so that you can be able to follow through her story. Thank you.
One of the things that we have said repeatedly whenever we had the opportunity to do so is the skill demonstrated by the secretariat that supported the task force. And I think those who have now had Priscilla Macau speaking have understood what the chair means and meant when I say that Kenya has a very big reason to be proud of the future of mental health when you have people like Dr. Macau as the owners of the future of mental health in our country. Priscilla, thank you so much for your presentation and ably summarizing the presentation by task member Halima Mwenesi. What Halima has said at the end is fascinating in a way, and I hope it will cause a bit of a conversation during this afternoon, because what Halima is essentially telling us is that security of our citizens is fundamentally a mental health matter. So that when we hear, as we heard yesterday and last week, that there are people who are suffering insecurity in the Rift Valley, it is right and proper that we should think about it as a security matter, because it is. But when we see Kenyans being displaced from their homes and having to stay night without being at home, we as a task force and as mental health workers, we can see further and say, beyond security, there are mental health consequences. Secondly, I think Halima has pointed out that the laws and policies of our land need to be looked at to align them with the mental health needs of our people. The people pointed out these things, and I think the government has received these views in the way that it was intended. And the last thing that I think Halima completely correctly points out is that the family, indeed as does the Constitution, is a fundamental building block for the Republic of Kenya. And promotion of wellness within this most fundamental building block called the family is really the cornerstone to the well-being of the Republic of Kenya. Now, I can see Bernard Olayo is still with us. Bernard, do you want to comment on Halima's presentation, please? And then we'll ask Dr. Njuguna to do the same. Dr. Olayo.
Yeah, thank you, Prof. And I think Halima captured it quite well, the main issues that are there. What it really shows us is that we are living in the midst of all these things. And sometimes people don't know that they could have consequences on our mental well-being or our mental health in general. And I think what was raised earlier is that everybody is at risk. Everybody can develop a mental health condition. And these are situations that could probably push us much closer to that. And I think these are things that everybody is aware of. They came out very strongly as we went around the country as matters that concern the citizens. And we would want in our recommendations and discussions with the members of the public to get your thoughts on, what can be done by yourselves, by the government, by the society to try and change some of these things. Coming from the World Bank, I know we can't make everybody rich in the next 5 years, but there's a lot that we can do at our current level to try and make the environment better for everybody. So happy to move into the next stage and really listen to what the people have to say. Thank you.
Thank you very much. Okay, Dr. Dr. Njuguna, you're a psychiatrist. You are the Director of Mental Health in the Republic of Kenya. You have an opinion on social determinants. The floor is yours.
So thank you, Dr. Jenga, Dr. Bernard, and that very good presentation we had from Dr. Harima, presented by Dr. Priscilla. I think this is the core of everything around mental health, the issues of social determinant of mental health. And basically, this is not what we focus on day-to-day basis. For a long time, when we talk about healthcare, we tend to focus on the illness, but not those circumstances which surround people and affect their health. And very importantly, the task force, and is in the report, I know it will be shared by my colleagues, there are key issues which we looked at: demographics. We looked at issues about economics, the economical, the well-being of the people, the social capital, that's to do with the social aspects in our society. There are issues about the environment. These are issues about the environment which we don't see them directly, like they can affect our health. And one of the focus of sustainable development goals is that you can't achieve the sustainable development goals without having the mental well-being. And when you talk about the determinants of mental health, I don't want us to focus looking at someone who is having a mental illness. We need to look at the continuum of mental health. And the continuum of mental health is from the being to a state of when you may be having mild distress to the time someone may be having severe distress and disability. And what are these factors, both at policy level, at system level, either to do with the environment, to do with our politics, to do with our demographics, which affect. Some may be what we call that they are very distant. You may not realize they are affecting you, that they are affecting you directly, and others affecting you directly. And I think one of the focus for us to address the issue of mental health, the public health approach, is addressing the determinants of mental health. These will bring development of the people, will bring good health, and the impact will be, enormous. So I think this is a focus we need to look at when you're looking at the issues of mental health, rather than the focus on the disease or even disease prevention, but looking at those broad issues which eventually affect people. They affect people in terms of either contributing them to developing mental illness, affecting them either they are not able to get health care, affect them that they are in a situation where they are traumatized. And I think these are very key factors we need to look at, and we engage them in our debate. Thank you, Chair.
Thank you very much. We said at the beginning that we would be welcoming questions. I've just looked at the Q&A, and we have a number of interesting questions. The first one is, can the government change the system of announcing new cases, presumably COVID-19, so as to reduce the anxiety and fear of death, and presumably give more optimistic messages? Dr. Njuguna, do you want to comment on that? Can the government change the system of announcing new cases and focus on prevention and management rather than the fear of death?
Yeah, I think that's a very good question in terms of as the pandemic evolves, we need to re-strategize in terms of the communication. I know there is a new communication strategy coming out from the Ministry of Health in terms of now, as people are learning a lot as we go along in terms of how we need to address issues of risk communication, issues of prevention, issues of intervention, gaining community solidarity, community trust, addressing issues of stigma. I totally agree. There's a new process going on to refocus on the new strategy of communicating with the lessons the government has learned so far. So
if I could just add on to
there are
that,
issues
Dr.
about
Go on,
updating.
Dr. Ari, go on.
It's still also important for the government to update in terms of issues of the disease burden, mortality, and all that. But probably there will be some few changes we expect as we move along. Thank you.
Yeah, I remember there was something very similar during the Ebola crisis in West Africa, where the initial messages were about death and so on. But I think as the problem evolves and as both government and the populace get a little better informed, the messaging itself seems to evolve in tandem with the changing times. Bernard Olaya, do you have a comment on this?
Yes, I think maybe the people who've been doing the announcement haven't really considered the impact that it has on the citizens. And I think it's important that we highlight this to them, that the way we are making these announcements, the way we are showing burials on TV is causing a lot of anxiety among certain segments of the population. And we could potentially find another way to deal with it. But I think more importantly, when you see this on TV and it causes you anxiety, it's already a sign that you may need some kind of support. And these support structures exist within different communities. You can get some kind of counseling, you can talk to someone, but there are support structures that people can rely on when this kind of situation makes you very fearful and afraid of death, because inevitably you can't run away from the information. When people die in your neighborhood, you'll get to learn about it and it will make you feel awful and fearful. And there are support structures that are in place that you can all rely on for coping mechanisms.
My goodness, the questions are coming in fast and furious, so we must move on. It's a very interesting question from a person called Desiree from Burundi. This is when you realize that we are talking in Kenya, but the rest of the region is interested. The question to you, Dr. Chuguna, is there any East African community policy on mental health? Do you have a strategy, Dr. Ali, that coordinates mental health in East Africa community?
Yeah, so thank you. I think that's a very good question because the East African cooperation and East African region, there's so much we have in common. Basically, from a global perspective, we are guided by the Global Mental Health Action Plan. This is a 5-year action plan or strategy, which is released by the World Health Organization, which we had a Global Mental Health Action Plan moving between 2014 to 2021, which has been extended to 2030. So what we do as the East African Secretariat, in terms of working aloud, what has been provided at the global level is to see how can we domesticate this. Do we have a plan in place to directly answer the question? Not yet, we don't have a plan. But globally we are guided, but then this should be customized by the issues we have as East African cooperation. And I think it's a high time we are able to, as Kenya, I know we may be doing quite a lot around mental health compared with our neighbors. But if we don't address issues across the East African region, then it could be issues happening in Tanzania affecting Kenya, which are happening in, especially we see a lot of conflict within our region and a lot of displaced population, and then migration of people issues of economics, if they're not working well. So when you're talking about determinants, and you're thinking that the determinants are things happening around you, which determines your mental health, you need to think not only of Kenya, but also regionally. So I think that was a very good question. And because we already have a health committee at the East African Secretariat, looking at different issues on health, I think is an agenda which can be put on the table.
Thank you, Daktari. Oh my goodness me. I mean, really, this is becoming a real conversation. Dr. Olayo, this is a question perhaps that is aimed at you, and it's maybe from the World Bank perspective, you could tell us, referring to Kenya as well, what, to your knowledge, is a strategy on dealing with domestic violence, particularly in this COVID-19 environment that we find ourselves in? Would you like to make a comment on domestic violence?
Thanks, Prof. And I think this is something I was looking at the comments here on how we deal with the gender-based violence at this time of COVID. But this is an issue that is pervasive. It preceded COVID pandemic. The COVID pandemic is just making it worse because of the additional social pressures that families are going through. And it's not just a health issue. It's a criminal justice system issue. And it's not just an issue of men beating up their wives or girlfriends. It's also an issue of women beating up their husbands and killing them sometimes. So I think there are things we can do at a personal level. One is speak out if you are living in a violent environment to get help. There are many gender-based violence recovery centers. We have FIDA offices, so you can get a lot of help from these centers. But speak out so that you can be helped. But when it happens, then we also need to involve the criminal justice system to deal with the perpetrators. But I think even before we go there are certain issues of mental health nature that are pushing some of these people into this sort of violence, whether it is stress due to unemployment or lack of cash, or drug and substance abuse, and all these things that can be addressed by the mental health experts within our community. But I think it starts with the people involved speaking out and reaching out for help, or their neighbors. If you know your neighbor that is going through such case, please speak out and bring them to care or to some support system, because it's impossible for the government to know what is happening everywhere. But if we know, there are so many things that can be done to help such people.
Thank you very much, Dr. Oh my goodness, this is really taken off. We have Margaret Mogaka from PC who says hi. So we say back to you, hi. That's all she says. So the next matter, which I will ask Dr. Juguna to address, is on stigma. This is a matter we discussed last week, but Dr. you were present when we discussed stigma and associated matters of mental health very, very briefly, because you have another presentation to make as we go towards the last 10 minutes of 15 minutes of our afternoon. Very quickly, Dr. Juguna, tell us about stigma.
Yeah, so I hope this question has been asked on stigma as related to COVID or as related to mental health
both,
or mental illness?
Both. I think it's both.
Yeah, stigma as it's a social process or socio-maladaptive issue which develop within a society when people tend to target a certain group of people, discriminate them, develop some stereotype about them, violate their rights. And most of the time, we have seen stigma is normally informed by lack of knowledge, sociocultural beliefs, and myths. And this now fits in within a scenario of like mental illness. People tend to associate mental illness with issues like sociocultural issues, religious issues, rather than see the facts about like what we are talking now, the issues of determinants, the issues of the mental illness as a disease. And so people come up with a way in which they stereotype people, they discriminate them, they violate them. And I think this is one of the major burdens because stigma itself causes more impact, more than the disease itself, what people are going through. And one of the key barriers to issues of good mental health in this country, or even to address issues like what we are talking about, barriers, is addressing stigma. Because from policy level to household level to issues of systems, if we don't address stigma, we will not have good investment in mental health. We'll have the community and family not treating people with mental illness where we'll have healthcare system also having the impact of the stigma. So stigma, I think, is one of the biggest barrier to issues of mental health in this country and across the world. And it has to be addressed by destigmatizing issue, by telling people that what is mental illness, by trying to deal away with the beliefs, the sociocultural myths and misconception, and also even at a policy and a legal level, that we enforce policies and laws that protect, but also empowering people who are living with the experience or living with mental illness so that they're able to come out, they're able to talk, and then we change the perception within the society.
Excellent, thank you very much. This is really very, very interesting and exciting. Rose Muraguri asks all panelists, I think I'm a bit of a panelist myself. So Rose Muraguri asks, if mental health structures are made mandatory in all sectors of employment, it would go a long way preventing and assisting mental health issues. Rose, you'll be happy to hear that when you read the report, you will indeed see that this is one of our key recommendations, that performance contracting by government in all ministries should require that all government people demonstrate that they are taking certain activities around mental health, very much along the lines of what happened during the war against HIV/AIDS. So indeed, your views are taken and are embedded in the task force report, and thank you for your opinion. This question from Dr. Esther Nyabuto to all panelists: victims of political clashes in the past and even currently experience a lot of losses, and this may precipitate mental illness. Absolutely right. And again, both the BBI and the task force report address this, because people who are taken through or go through the kind of clashes you're talking about not only suffer from the mental stress associated with injury, including post-traumatic stress disorders, they also suffer the additional and consequential economic losses, but also the fact of the uncertainty of geographical and home location displacement. And I think what is interesting in both the task force report and the BBI report is that both found that what appears to be remote from mental health is actually, at the very least in the view of Kenyans, very much a matter that is close to the hearts and minds of Kenyans as a mental health issue. Now, this clock, I don't know why on Mondays it runs so fast, just when the conversations are getting very interesting. It happened to us last week and the week before. For that reason, I will now ask Dr. Njuguna to address a question that was raised last week, which was, now after talking like we have talked, what happens next? Is this another report that will gather dust, or do we have any indication that the government of Kenya has plans that will give effect to the finding of the task force report. Dr. Jogona?
So thank you, Chair. I would like to say that the task force report, which now is a public report, after it was handed over to the Cabinet Secretary for Health by the members of the task force, will now continue the process of what I can call the process of mental health reform in this country. And it's part of the presidential directive, which was given last year during Madaraka Day. And now the report has moved from the hands of the task force members who had a very clear mandate. What not they thought, but analyze and say these are the key issues affecting mental health, and these are what we think are the recommendations. In the document, again, also there is an implementation plan and how the government should go about doing this. So this document from the Cabinet Secretary for Health will head now to the full cabinet, and it will be scheduled a date to be discussed by the cabinet, because the cabinet is the one which made the directive that this task force to be formed. The cabinet made that directive after seeing all the documents which are there, seeing the legal document, the policy document, and other government documents which are there, and the work which has been done before. But then they really wanted to hear what this task force, independent people, go up to the people there, have a public participation process, and come up with it. So once it gets into the agenda of the cabinet will declare itself on this and give very specific directive. This directive will be looking at the whole government approach, because as you have seen today, talking about determinants of mental health, we are talking about political, socio-cultural, economic issues, environmental issues. And so they cannot only be handled about by the Ministry of Health. And we need to have this paradigm shift from not only addressing the issues about the illness, but also addressing the issues about resilient society, communities which are friendly, and which is very well built in the process of what we call the primary health care, but more that even looking at the broad spectrum of all those issues. And the task force put their recommendation very well. I can put that the recommendations are on a number of areas. One, they have specific recommendation which addresses issues of policies, how policies can be implemented, what are the key policy issues which need to be put up across the various sectors of government. The second one is on the issues of legal reforms. They clearly identified, and they are there in the annex of this report, that this law is discriminatory or is offensive to the well-being of the people, the mental well-being of the people, or even persons living with mental illness. It requires maybe amendment, or it requires full implementation. And so that is very specific. So there are issues of legal reforms, there are issues of policy reforms. That they are what we call leadership and governance issues, that we need to create some institutions for us to address issues of mental health in this country. And they are very clearly elaborated in the report. And so what will be the next steps of the government is some of these institutions, some may require legal actions, some may just require administrative action. And now comes to the administrative action, which is majority of the issues which need to be done. Administrative actions means that it's not requiring a new policy, require no legal issue. It's just within the government systems. And the key of these is what the task force recommended, that this become part of the performance contracts of all ministries to address specific issues, whether it's the Ministry of Education, whether it's the Ministry of Labor and Social Protection, whether it's the Ministry of Finance. There are key administrative issues which need to be addressed. And then there is the issues of finances and investment. And so there are quite a number of finances, the declaration which will be made. And so the government may make a decision about how we raise these resources. Responsibility of the Kenyan people in the private sector, the NGO, and the Kenyan themselves. This is a public document. We'd encourage all Kenyans to start having a discussion about this report looking at it in a wholesome with the necessary other instruments which are there on mental health, like the laws, the policies, and start putting the government to the task that we are ready to work with you as a government to implement this. So as a ministry, as we wait for the cabinet to declare itself on this, we'll continue the process of disseminations, the process of engaging stakeholder, but also developing the necessary instruments. We'll develop strategy, we'll develop guidelines, we'll develop some new laws. So that will be work going on. And I think that's basically what it takes for us to move this document to the next level. Thank you, Chair.
Thank you very, very, very much, Daktari. I think that gives Kenyans in general reason to hope. Dr. Olayo, I can see you're still with us. Do you have any comment on the way we are moving forward? Will the World Bank be able to assist Dr. Jugona, government, and ourselves in the implementation of this? Or yes, Bernard Olayo.
Thanks, Daktari. And today, I want to say I wasn't speaking on behalf of the World Bank. I'm speaking as a Kenyan today who was a member of the task force. But these are very pertinent issues that if the government of Kenya wanted to pursue further discussions with the World Bank, I would be very happy to provide guidance on who to speak to. But I think issues that have come up that some of them have been responding to on text are issues of where to go. I think this violence issue is raising a very important, it's something that people identify with a lot. People asking where can they go? Are there male shelters if men are abused? Where this gender-based violence recovery centers, and that we're providing that information on the chat so people can get it. But I think at a high level, I think it's important that this report is putting mental health front and center of our development agenda as a country. And the same way the government of Kenya prioritizes HIV and malaria and other things, I would like to see them putting a lot of emphasis on mental health and well-being of the citizen, monitored through the happiness index. That was also a very important social media discussions around it, so that we can track how well we are doing over time with our mental health programs as a country, because that is the basis of our productivity. If people are well, then we will become more productive. If young people are mentally okay, they'll do well at school, they'll achieve their goals. They will be the future of this country. But if they are not supported at this time, I think we will lose an opportunity to compete in the global space. So it's a very important area, and happy that at least we are discussing some of these issues.
For those who may not have understood what Dr. Olayo has said, the truth and reality is that mental wellness is a development matter. It's a development matter because, as Dr. Olayo has said, children who go to school and stare at the teacher talking and do not internalize what the teacher is talking about really will not become productive adults, because they will lose out on what the teacher is saying to benefit the children and later to help the country. And therefore, economists must quite correctly take an interest in what is happening to our children who are not benefiting fully from school. Secondly, we know that there are very serious and significant consequences to employees who are present at the place of work, but who are so severely distressed or stressed that really their productivity at their place of work is less than ideal. And it's not only at the place of work. There was a recent study presented, I think at an Akada workshop, that demonstrated that depressed farmers, for example, are unable to produce as much coffee or tea, whatever it was, as non-depressed farmers. So Whether you're working as a school teacher, whether you're a student, whether you're a farmer looking after cows and goats, the fact of having an unrecognized mental illness can impair your economic productivity, and hence the interest that has been shown by economists, World Bank, and our government as well in the management of mental illnesses in general. Now, Dr. Juguna, this is an interesting one that actually very nicely dovetails into what Dr. Olaya has been saying is a question about how is our government taking care of you and I, frontline medical workers, with respect to our mental health during this COVID-19 era. So over to you, Dr. Juguna. Is the government looking after its people?
Yeah, so thank you, Chair. I think that's very core to some of the strategy the ministry is having in terms of the psychosocial well-being of our healthcare workers, because if our healthcare workers are affected, then they are the front line in terms of addressing this pandemic. And then that will be a great loss, and we'll have lost in our strategy to combating this pandemic. A key thing is making sure that the healthcare workers, as they go out there, knowing that they will be at more risk than anyone else, that they feel that their welfare is well taken care of. More than that is that they are well protected. The issues of personal protective equipment is very key. That they are there, that they have the equipment, then they are regularly can be able to access the testing in case they feel that they are very much exposed. And if they are affected, there are ways, there are structures and systems in place they are put that they can go through them for getting treatment, and also even their family being taken care of. So once a healthcare worker feels that there are systems and structures put in place to look at their welfare and what can be done in case they are exposed, then it means they can work out there free. Saying that doesn't mean that we are not having challenges. There are still challenges within government about where we'll find some healthcare workers saying that they're not having enough PPE, where there are issues about infection prevention control because there are systems and structures to do that beyond the PPE, where in terms of can they have access to psychosocial services. But there to talk about the access to psychosocial services.
Thank you very much. Yes, go on, Dr. We are listening.
We have invited the healthcare workers associations, and one of the associations is Kenya Psychiatric Association, working with the Kenya Medical Association, the Association for Nurses, clinical officers, to come together, and we are able to put up a wellness center, which is providing psychosocial support to the healthcare workers. That is an effort being put that wherever they are, the healthcare workers, because we have seen studies coming from China or even during other viral epidemic, the impact it has on healthcare workers is more than other people. So there are preventive measures, there are systems to address their welfare and also protect them. But there are also challenges, as you know, we are learning a lot during this pandemic. A lot has just come to the government at once. But moving forward, there are massive effort being put to see we address this. Also working with partners, some partners have come in a big way to support the healthcare workers. Thank you.
Thank you very, very much, Daktari. I think there's another issue that
Dr. Njeng, I could just add something, I think, to what Simon has just said. One, I think, is the issue of health workers. You know, they leave home every day, they're going into the hospital, and their neighbors know the hospital has COVID-19. So when they come back home, one of the challenges that we are seeing, not just in Kenya, is that there's discrimination by their neighbors. People don't want to interact with them. And that in itself, you are working in a stressed environment and you come home and your Mama Mboga doesn't want to really be close to you to sell to you tomatoes because they think you're bringing COVID from the hospital. It's a one way that is affecting the well-being of health workers. And the population can help a lot by supporting frontline health workers, the way I'm seeing many countries really coming out to support their health workers, because without frontline health workers, if this thing gets out of hand, we will be left to our own devices. So I would really want to appeal to the people here to really take care of our health workers when they come back to the communities where they live. And thirdly, lastly, I think one issue that is really linking very strongly is our teachers. They interact with our young people, and we need to think of ways of empowering them so that they can pick some of these effects of violence at home, or drug and substance abuse, or any abnormal behavior. If we skill them more effectively, they will be able to sieve for us as a society and tell us what is happening to our young people and bring them to care early before the damage is done. And someone said, and I agree with them, that family is the foundation of it all. I agree with you 110%. These other things can only build on what is happening at the family level. Over.
Thank you very much. I think we are making very good progress. I think as we have achieved at the very least one of our objectives, which was to make today's conversation truly a conversation. I have a number of comments. For example, poor Pauline Rikanga says, oh, yeah, I got in late. Will we be able to get the recording, Priscilla? Are you going to record this and let it appear?
And the answer is yes. I think they've replied to them on that.
Oh, very good, 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 good. And the next question from Rowena. I think this is Rowena of Kenya Medical Association. I'm not sure. Are we working with the Counseling and Psychologists Association? I think that's a very emphatic yes. We are working with that. And I think it was last Friday or Thursday that there was a very, very interesting webinar titled Physician Heal Thyself or something equivalent, which was an interactive session involving doctors and nurses who had tested positive, and they talking about their own journeys and the kind of psychological support they felt they needed or were getting. So really the conversations about how important it is to look after our health experts, really, in all respects, is critically important. Now, ladies and gentlemen, we have 2 more minutes before we have to call it quit. I don't know why time goes so fast. So I will give Dr. Olayo 1 minute to make his closing comment. I will ask Dr. Juguna to make his last comment, and then it'll be time to go away and do other things. Bernard Olayo.
Yeah, thank you, Dr. Njenga, and thank you everyone who participated today. It's been a great honor to serve with this task force that was really well selected and had really good people that I've learned so much from. We've learned so much from talking to Kenyans across the country, and we do hope sincerely that the information that you gave us will not be sitting in a shelf somewhere for long, but will be used to improve the way we provide services in this country. So with those really few comments, we hope that you'll support each other, and that if you see someone that is in trouble, you will reach out to them and link them to care, because you never really know what individuals are going through behind their closed doors. And before the doctor comes in, you are their first doctor. Thank you.
Thank you. We're getting the conversations going on. Our brother is from Burundi is telling us that he is or she is a psychologist and that they've really enjoyed this presentation. Dr. Guna, there's a very interesting question that you must address as you make your closing comments, which is how are leaders coping with this whole thing? Are they coming for help? Question mark. Dr. Juguna?
Yeah, I think there is, when it comes to issues of mental health, or even if it's about COVID, what our participant is asking about, this doesn't choose. Everyone is at risk, whether you are a leader, your race, you know, your financial background. It has no choice. And we need everyone to come out, because it's okay not to be okay. I know that the hashtag people are having, that you need to come out. We know people, because of all these things, they think because I'm the leader, I'm the political leader, or whatever type of leader, sometimes they shy away and they have what we call self-stigma. But we tell them, come out. When you come out, if the leaders can lead from the front and we see them coming out, then this will bring a lot of change. So we encourage, it affect everyone, and we encourage our leaders to come out. On my parting shot, I would say this has been a good time in this country, and I've been happy to be part and process of this engagement in trying to bring mental health reform in Kenya. The work the Taskforce has done has been tremendous, and we have a very good report. But I would ask people out there, let's work together to see that this report come to fruition. What I would also say, that the topic today was really clearly what we found out from the people out there. The people out there, they are talking about unemployment. They are talking about issues about lack of social cohesion. They are talking about how the politics are affecting them. They are talking about climate and how these affect their mental well-being. And this brings to the focus that for us to address issues of mental health, we need to go beyond looking, we need to look at the whole society in general. Mental health is a developmental issue, and that's the only way we are able to have a healthy population, and a healthy population means a productive nation. Thank you.
Okay, thank you, Dr. Ari. Shiro, you have a very interesting point. You say, Shiro, thank you for taking my question. The next question is that a special team to reach to leaders in a gentle, diplomatic way. They are under a lot of stress. Interesting. This COVID thing is very democratic. It doesn't really know who is a leader. I mean, poor Prince Charles was one of the earliest ones to get it. Johnson, Bolsonaro in Brazil. Really, this COVID thing has democratized the world in ways that nothing seems Noah's Ark seems to have done. And whereas leaders have a very special responsibility, particularly political leaders who must make impossible choices, and all of them, I can tell you, whether it's Kenya or Brazil or India or Australia, are impossible choices between lives and livelihoods. Really, you're right, they probably do need a special care. And perhaps one of the things, Bernard, and you, Dr. Juguna, we didn't discuss last week, or last week actually, are our leaders as a special needs group because of the things that you're saying, Dr. Juguna. Because of being a leader, and the coldest place in the world is at the very top of any mountain, their health-seeking behavior, or in general, their help, not just help-seeking behavior, is something that I have over the years noticed puts leaders in general, not just politicians, in places of very special risk. Perhaps what we could do is, as we are coming to towards the end of this series, we could ask if it is possible to hold a conversation of how much as we're looking after our first-line workers, our doctors and nurses, frontline workers, our political leaders are also very, very important. All leaders are very, very important. how are we taking care of them in the way that Shiro seems to be proposing. Excellent point, Shiro. I hope you'll be available to us next time we hold this conversation. Ladies and gentlemen, I have to very sadly bring this conversation to an end. Thank you all for your fast and furious questions and comments. All of them have been recorded, and to the extent possible will be responded to. With those remarks, that brings us to the end of this afternoon's presentation. Yeah, I see my old friend Stephen Mwenesi, a relative of Halima Mwenesi, has written me to say thank you. Steve, thank you very much. I'm glad you are listening. Thank you very much. And if you can, pass our grateful thanks to Halima. Her contribution was most gratefully received by the task force and by, I'm sure, by the people of Kenya in general. Thank you all very, very much, and have a good evening. Bye-bye.
Bye.
Thanks. Thank you, everyone. Bye-bye.